me, O thou great Redeemer, pilgrim through this barren land. I am weak, but thou art mighty. Hold me with thy powerful hand. Bread of heaven, feed me till I want no more. Feed me till I want no more. Open now the crystal fountain, whence the healing stream doth flow. Let the fire and cloudy pillar lead me all my journey through. Strong deliverer, be thou still my strength and shield. Be thou still my strength and shield. When I tread the verge of Jordan, will my anxious fears subside. Death of death and hell's destruction, lead me safe on Canaan's side. Songs of praises, I will ever give to thee. I will ever give to thee. My name is Sister Mary Joseph. I am a missionary Benedictine sister. I am a teacher by profession. I would like to share my inspiring story about my survival with cancer. I am a breast cancer survivor. I was diagnosed with this disease at the age of 40. Now this is my 5th year of survival. And though my life has changed, and I know that I will never be the same again, I believe that my Redeemer lives. And I testify and confess that I believe in the upholding power and the healing power of God. And as I share with you this brief and inspiring story of my life, I would like to encourage all of you to come out of the fears you have about cancer and cancer patients. It is not every cancer patient who dies of the disease. There are stages in life where one may survive, depending on the detection of when you realize that you have cancer and how quick you responded to the medication. So I welcome you as you view with me. I hope your spirits will be raised and you will feel encouraged. Move out of your fears as I have moved, and let us face this traumatic experience with courage. As I share with you, I will share my time before the diagnosis, the signals I had before I was diagnosed with breast cancer. 2, I will also share with you how I was diagnosed. I will share with you how I went through the surgery before a very great and miraculous event happened between my surgery and the results after the biopsy. I will share and encourage you through my experience in radiation. Again, I will talk about chemotherapy, which is a traumatic experience for most of the patients and for most of you viewers. When you hear about chemotherapy, you imagine so many things. I will share with you my post-treatment experience. Again, I will share with you about my relationship with my God as I went through this traumatic experience with cancer. And I will also share with you what happened with my relationships with others as I went through this traumatic experience. Then I will advise you on what I think as a nation, as the world, as we face this traumatic disease, that we can help ourselves and the way forward. You're most welcome. It all happened during the month of May, the year 2009. I started getting fatigued as I worked, especially when I was working alone or I concentrated on my work. Then from there, when I woke up in the morning, I started getting dizzy. I started having stomach upsets. I started having headaches which did not have, which were a bit, not so much, but frontal headaches. And the climax of it was when I woke up one Thursday and my pressure was very high and I had ringing on my ears. I was frustrated and I could not wake up to go for prayer. So I went back to my bed. I tried to elevate my feet, but when I put my fingers in my ears, the ringing in my ears went to the middle of my head, and actually I felt like I'm getting mad. When afterwards our caretaker, the nurse, came, she came with our superior, and I explained to them what I was feeling, and they assured me that, and indeed, my pressure was very high. So they checked on me and my pressure was 168/110, and that was very high. And they assured me it can happen and it will calm down. So I was given some medications, and unfortunately, until 9 a.m., my pressure was still very high. So we booked a doctor in Kenyatta Hospital, Doctor's Plaza, Dr. Murithi Nyamo. We were to be there by 2, but we were only attended to at around 4 o'clock. When we went in, the doctor examined me, checked my pressure again. Unfortunately, my pressure was going higher and higher. It was now 178/110. But the doctor assured me that it is possible to bring it down with the medication he was going to prescribe for me. So he gave me a 1-week medication, and then I was to go back for review after 1 week. We went back home. After 1 week, I went back to, this time not to Kenyatta, but to Aligam, where Dr. Murithi Nyamo has his clinic. Again, my pressure was just stable, not actually coming down, but it remained high at 168, between 168 and 178/110, and it was becoming frustrating. Again, he changed the medication and gave me a review after 1 month. When I went back after 1 month, there was no change. I was becoming weak. I went for kidney check. I went for chest X-ray. I went for pelvic ultrasound. I went for ENT to check on my ears. But when we came back, the results were all perfect and good. But the question was, what was causing what was elevating my pressure? And now I had to become a patient in the house. I could not work. I was scared. I did not know what was transpiring. When after talking, I woke up, I worked on my dress and I felt a lump on my left breast. But I assured my friend that I'm not going to inform anyone. But I felt it was not something that was so good. I was convinced beyond my conviction that that lamp was not good. Because I tried to push it, it could not push. I tried to imagine it is something that has beaten me, but the lamp was so firm, it was so planted, and I got scared. As we went back to the house from where we were seated, Sister encouraged me at least to share with the house nurse. When I went inside, I went straight to the house nurse in our infirmary, and I told her to palpate and see whether it's true, it's a lump. And when she palpated, it was. But it was so small that she felt it was not posing any danger. But I still felt that I needed to talk to someone else. And I asked her if I could speak to our superior, and she allowed me. So I went and into the office of our superior. I found Sister Michael Marie. She was busy working, so I told her, I think there is something on my left breast and I'm not comfortable with it. So she just touched above the dress, and for sure there was a lump. And she told me, this is not good. So tomorrow, we have to go to hospital. So the following day, she had to take me back to Aligam, to my oncologist, that is Dr. Nyamo. And when Dr. Nyamo examined me again, he got anxious. I saw he was suspicious of something, but he told me he doesn't like when people have swollen things on the bodies. So then he referred me to Nairobi Hospital for a test which he called fine needle aspiration. I didn't understand what it was. So since it was late, we had to go the following day, which was Saturday. On that fine Saturday, I went with our caretaker, Sister Rafaela, our nurse in the house by then. We were in Nairobi Hospital laboratory by 9. Then when we went in is when I knew what is fine needle aspiration. Actually, they prick the lump and they draw some specimen from it to be taken to the lab for tests. It was a painful experience for me. But since I knew that it is the way forward for my treatment, I bore the pain. Then we were to wait for 1 week. After 1 week, on a Friday, we went back, collected the results, and we went back to Aligam again to see Dr. Nyamo. Upon opening the results, he told me the results were not clear. This is a suspicious lump that needed more investigation. So he told me, Sister, I'm referring you to another doctor who deals with such swellings in the body. So I was referred to Upper Hill Medical Center. And since we didn't have what it needed to be there, we planned to go on the Saturday. So we went home, and then on Saturday we went to Upper Hill Medical Center, and we met Dr. Bernard Dungu. It was around 3. So I got in to see the doctor at around 4. Again, he examined me. The lump was so small that when I lay down, you barely could feel it. But when I sat up, it could be felt clearly. So he told me lumps are not good things, and therefore he will do a biopsy, and then we will see the way forward. So he requested me if I could sit outside and wait until he finished with 3 patients who were behind me, so that he could do what he was supposed to do with ease. So I sat outside. When the 3 patients were over, I went in, and down on that I remember green, white covered, halfway covered with white sheet. I lay there. He did what we call a needle biopsy under loco. Loco is something to make me not have a lot of pain. The needle was so big that I was scared. But he pricked around the lump, drawing some specimen from inside. At some point it was so painful and I had to stop him. So he had to add more loco, and when the exercise was over, he showed me the specimen in a test tube. Then he explained to me that he will take it for histology. I didn't understand what was histology, but he explained to me that he will take it to the laboratory. They will test it, and whether it is malignant or benign, on Tuesday I must go to theater. So somehow he prepared me prior to going to theater, but I still could not understand what was happening in my life. He was not calling it cancer. He only talked of benign or malignant lump. So we left the hospital, and he assured me by Monday the results would be okay. The results would be out and he will let me know. Meanwhile, I informed him that I am a student, and on Monday I would be in school. He told me he will call me. So I gave him my number and the number of my superior. Monday came. I remember that terrible Monday. At lunchtime is when he called me. I can vividly remember his words. I can quote, "Hello, am I speaking to Sister Mary Joseph?" And I said, "Yes, I'm Dr. Dungu, and the results are out. And I need you in hospital now because we are likely to pull out the whole breast." His voice thundered on my ears. I remember that pitch dark Monday. I remember that pitch dark Monday, and before I could talk to my friends, I called the doctor back and I asked him to repeat what he told me, and he told me he needs me in hospital immediately and they were likely to pull out my breast. I could not take it in. So I